Hi, welcome to my next installment of Yoga Therapeutics with TCM and Ayurveda co-starring. Today we will focus on the knee joint. So there are three specific dysfunctions that we'll go over today. So they're the most common. The first, obviously, is arthritis. And with arthritis, we get old and our joints get used up. So we'll address arthritis with movement. So the best thing for arthritis is to keep moving. Of course, you want to work with your pain to a certain extent, but of course not overdo it and rest when you need it. But movement is absolutely vital to keeping the knee joint lubricated, to keep feeding the cartilage, especially the meniscus. And that brings us to our second focal point, which is the meniscus. So we get tears in the meniscus, they get cracked. And the thing with meniscus is it will present as swelling and a lot of pain. A lot of times there'll be like a distinct cracking sound in your knee joint when you go up and down. So with the meniscus, we will think about, first of all, resting it, because you really can't move so much on the meniscus or on a tear of the meniscus at first. So as it starts to heal and feel a little bit better, you'll start to load it little by little. And so there are a few different ways we can do that and approach it. So, but first and foremost, the meniscus injury will require some rest and just laying off the joint. The third and final is typical in injuries is, of course, the ACL, the ligament tear. And because the ligaments are cruciate, they cross front to back on the knee joint to stabilize the tibia. So the tibia will move forward and there will be a lot of instability created with an ACL tear. And the thing with the tear of the ACL, will approach it by really strengthening all of the supporting muscles, which are mainly the hamstrings and the calf and the quads. So all of the support of that structure. And for the ACL, we don't have to worry so much about loading. It's more about instability. So we want to make sure we're stable. So you have a surface to work from, you can work from a wall, just make sure you're not going to, unbeknownst to you, just move around suddenly and lose your balance. So we don't want to do that. So stability, ACL, meniscus, rest first, and then start to load it little by little. And arthritis is feed that cartilage, keep moving, keep the joint lubricated. All right, so we're talking about the knee joint, which is a hinge joint, but it's not perfectly, or it's not isolated to just an ordinary hinge. There is a slight amount of rotation that we get in the knee joint. So first of all, you know, we're designed to squat, but culturally we have forgotten how to do that. We work in chairs too often and too long, and we wear shoes. By the way, I have socks on today because you'll see later I'm going to slide up and down the wall and I don't want to make my wall dirty. So, but please don't wear socks if that's going to create any instability. Also, I'm going to work with, I'm going to show a little bit of posturing with an exercise ball, if you have one or don't, but they're really invaluable in my own practice, especially when I'm injured And we will also work with a therapy ball. So these are a little bit squishy, more squishy than a tennis ball would be. And they just fit nicely in the palm of your hand. I get mine from Hatha Vida. You can email her. That's Tanya at Hatha Vida, and she sells these great therapy balls, but I think you can find them pretty much everywhere. So again, I want to remind everyone that flexibility should come from the release of muscle tissue and not from overstretching of the ligaments. So one of the key points that we address in yoga therapy is always maintaining almost the stiffness, you almost want to think about rigidity, which is unusual, but with ligaments, yes, that's what we go for. We want them tight. We want them working to hold the joints in place, not stretching the ligaments, but letting any of the stretching happen in the muscle tissue. All right, so we want to avoid that overstretching of the ligaments. And just again, to remind everyone, we are not a car comprised of parts that can just be replaced in and out. We are living tissue, and all of those parts are connected to a whole. And always we want to honor that wholeness that is us, and not this Western idea of isolating everything. Okay, we look up and down the chain. Often the feet are the issue for a lot of knee problems. And a lot of times the issue of knee problems ends up being the result of a low back problem. So again, this stuff of energy and constriction and rigidity and imbalances always works up and down. So keeping that in mind, therapeutically, we approach these problems with closed chain practices. Closed chains means one or other of the extremity is fixed. That could be to the ground, the floor, or to a wall. Open chain is more physiotherapy. Yoga is pretty much all closed chain. Closed chain can also be loaded and less loaded. That means more weight applied to that closed chain approach or less weight, depending on where you are in your healing process. And also we will work with co-contraction, which is contraindicated, say that 6 times really fast, for those of you that have high blood pressure. So we want to make sure that you realize that. And co-contraction is an isometric contraction at the same time to opposing muscle groups, like the quads and the hamstring contracting together, kind of squeezing everything in. A lot of times in yoga, we say hug the muscle into the bone. That's sort of like co-contraction. That's really great with stabilizing and creating a lot of strength. And then the last one, pretty much everyone knows, proprioception, which is a very important therapeutic or very significant in the therapeutic management of these problems. So mapping the position of the body along with the muscles and the ligaments, even though you might not always know where they are, is starting to understand and get that sensitivity towards what's working against what and how the tissues are supporting the structure of the joint. And yeah, so just mapping that in our immediate awareness, learning how to figure out where our body is in space. Really important protocol in our therapeutic applications. Okay, so the first, what I'll go over is some of my favorite acupressure points. The first one is kidney 1, and this is a really great grounding point. So it's right at the center of the ball of the foot. And you'll just feel a little bit of an indent there. And you can take your seat in any way that's comfortable and just apply some pressure there. So I'll go over all the points right now, and then we can maybe apply a couple during the session when we're in a certain position or in a certain asana. So I like to hold these points for 3 to 5 minutes, but just for the sake of time, I'll just hold them for like a minute or so. You can give a massage. This point can sometimes be tender, but everything starts at the feet, right? So we start here and just breathe smoothly. If you have someone to do this for you, it's even nicer, always. And then we'll go into, see, the next point will be, where did I write these down? Yeah. Will be stomach 36. And this is one of those, this is called leg 3 mile. This is one of those really universal points that almost everybody has heard about if they've ever been to acupuncture or acupressure, or even a Chinese foot massage. So this is a really good one just for anything with the legs. I like it. It's really strengthening, and also is known for boosting our chi, our vital force, very strengthening for the blood. So the way we find it is we find the bottom edge of the inferior, in therapeutic terms, of the patella, the kneecap. And then it's going to be 3 sun, which is a measurement. That will be 4 finger widths down from the very bottom of the kneecap. And then you just kind of go over, feeling for the indent of the shin bone on the lateral side. This would be the outside. And just feel where you can start to feel the muscle on the outside. So it's right at the edge of the tibia, of the shin bone, laterally. And you can just connect with that. This can also be a little tender, but it's more of a yang point. So for most, it will probably be a little stronger, like not willing to give. So it's a good, strong massage here with some of your finger points, maybe a group of your fingers. It's really getting in there. And then holding it, really creating a nice, deep breath as you hold. So it's right here. Right below the kneecap. 4 sun on the lateral edge of the tibia or the shin bone, right into that muscle. Okay. And then we have spleen 9. This is great for pain and swelling. So that's kind of on the other side. It's on the inside of the leg. And you'll find that kind of bump on the lateral side, and just going down from that bony protuberance. And again, you'll feel that bone and go right into the calf muscle, the gastrocnemius, and press there. So one is here, one is there. The spleen is a little higher up on the inside or the medial side. Okay, so those are really good points. And then the last one is gallbladder 31. It's on this side of your IT band. And to find it, Just stand up straight, have your arm alongside of you, and at the tip of your middle finger is the point, Gallbladder 31. This is really good, especially for lateral knee pain as well. And IT band syndrome, which a lot of us have, especially if you run consistently or bike. So the side body gets really tight and it draws in, kind of sucks in tension, especially in the IT band. It's very dense with connective tissue. So we'll use the ball, and I'll show you how we can do that a little bit later on. So we'll first start with just kind of warming up. Bring your hands to your knees. You can bring your knees together, feet together, and just take little dips and circles. As I said before, the knee joint is a hinge joint, but not a isolated hinge joint. It has a little bit of rotation included. So go in different directions. You can go a little lower, a little deeper. Don't forget to breathe. Go in the opposite way. This also helps to warm up the ankles. And the hips. Go down a little lower if you can. Okay, and then I'm just going to do kind of like an ape pose. Ape, A-P-E, ape, like monkey, like big, fat monkey, big, giant monkey. All right, and then, although it's not really a monkey, it's an ape. So let your limbs just go, get heavy, and feel all the hinges kind of working together in your body. And this is just good to just wake up the joints and just get a feeling again for that proprioception, where you're hinging, how deep, where there's any sense of restriction or limitation. Also, it just helps to feed the tissues with this bouncing action in the body. Bouncing is very hydrating and moisturizing. Yeah, so just give it a little bounce. Give it more and more weight if you can. And then we'll do Tadasana. Also, I forgot to say, we'll use some blocks too. It's great just to kind of give your body placement, and again, bringing that proprioception into play. It almost acts like a spacer. And then you can go up and down. It's kind of hugging that block in. You want to really stay nice and tall in the body, belly firming and toning back against the spine. And keep working the outer ankles, the outer knees, the outer hips in towards your central line, your medial line of the body, of your energy. And then you can do the same thing with chair pose. Okay, and you can not have the block this wide. You can have it a little thinner if it's better for you. You can also work a block in between the thighs, which is nice for the knee joint as well. These are a little bit of the heavier blocks, so I don't like to lift them and squeeze them up too high. I kind of like to keep them on the floor. And then just bending down, making sure that alignment of the knees are straight forward over the center of your foot. Get that nice tone in the lower belly. And just working downward. And so there's a little bit of eccentric or eccentric contraction in this pose. That's lengthening of the quad muscles here as you go down, kind of resisting the gravity. And we'll kind of use that a little bit more in this next position. It's really helped me in my own therapy of healing a meniscus tear back in the day. And again, if you use blocks and you step on them, make sure you're stable. I could, I know I'm pretty balanced, but, have them near a wall where you can really be sure. And you can start with just one. I'll actually start with one. So stepping on one block, we're also going to incorporate that eccentric contraction, stepping down. So we're working the leg and the knee joint on the block. And we're just using the right leg as guidance, really. So stepping down with the right leg, just keep it straight. And lifting and lowering in the left leg and working into that eccentric contraction, lengthening the thigh muscle, the quad as you lower. And you can feel the hamstrings and the calf muscle really working together on this too. So there's that co-contraction. Good. I would do like about 15 of these, take a break and do about 15 more. But do as much as you feel is good. So turn and you can do the other side and you can step it up a little bit if you're stable. So just making sure that knee is aligned again, pointing towards the center of the right foot. Lifting and lowering nice and slow to increase that eccentric contraction as that muscle lengthens and contracts at the same time. I like to touch down with the heel, but you can touch down with the foot as well, the top of the foot. This is a lot of work also for the glutes and the hip. All right, firing up that quad. All right, so we have the eccentric contraction, and you'll notice how often we really use that in practice. Those were called elevated letdowns, by the way. So we let down in gravity or against gravity or resisting gravity when we slowly lower to the floor. We also do that from plank to chaturanga, lowering all the way to the floor. So we do that a lot in yoga. The next one is we're going to work isometrically a little bit with co-contraction. And we're going to bring ourselves to a wall. You're going to bend your knees. Remember, be stable. You don't have to be completely down with a 90-degree angle. It could be a little higher up, more like 45. And then we're going to use this isometric contraction of pulling, creating this resistance, pulling one knee forward as the opposite knee goes back. But they're really not going anywhere. You're just creating all of that tension around the joint, working all of those muscles in this co-contraction. So again, this is contraindicated for those with high blood pressure because it can sometimes increase that because you are pressurizing the body. And then just go to the opposite side, where the opposite knee is going forward and the opposing knee is coming back towards the wall. But they're really not making too much headway there. You're mostly just creating that resistance for them by working those opposing muscle groups. This is very strengthening. And even if you go down to that 90-degree, it increases the load somewhat, but I feel like I'm not really making all that much more headway. So make it more easy on yourself where you can really concentrate on the co-contracting instead of just feeling it all in your quads by coming down lower. So it's not really serving any purpose. So that would be a good one to do at least like 10 on each side. So you can stay with that. And then for the next one, it's really working just the structure of hinging. So you see a lot of people that can't sit back with their seat on their heels. And there could be a lot of reasons for that. It could be, a lot of it is, could be in the ankles, which will be my final segment in a few weeks. We'll do wrists and ankles. But again, it's a lot of it is the knee as well. So we can start by working onto blocks, and you can build up your foundation. I just happen to have 2, so that's my limit, but you can build onto that. So you can make yourself as high up as you need to. And then using that eccentric contraction of lengthening the muscle as you lower, you start to work into the hinge. This is a really good way to build that capacity in your joints, just nice and slow. And eventually maybe you get just to 2 blocks. And then if you're on 2 blocks, you start to work slowly down to 1 block. And again, the blocks are great because they're a nice spacer so that the inside of the ankles can really be snug against the side of the block. And that, always remember the toes face directly behind the knees, not kind of curving out to the side. So we want to really be straight in the bones, keeping the alignment together. And again, building that proprioception. So again, working from on the knees to slowly lowering through that eccentric contraction. Working into the flexibility and mobility of our joints. And then eventually maybe undoing, getting away from that block completely and coming down to the heels. And again, eventually you'll get there. It just takes time and patience. You can also hold someone's arms to do this. This is also a great way to get yourself down into a low squat, keeping your heels down to the floor, is working with a partner and using their weight to balance on the way down. All right, well, my quads are definitely firing up. What we'll do next is some standing balance poses that will build again into that the supporting muscles to really help with the tears in the ACL and also building up the meniscus tissue. All right. So I'll first show with the ball. This will be less load on the joints. So if you're coming out of your meniscus injury and you're starting to be a little bit more willing to work into more poses, yoga, and coming back to practice, or maybe you're starting a practice, maybe you really feel like that's what has tipped you over to the other side. Welcome. Anyway, so we're gonna just use the ball to let us kind of hold a little bit more of our weight so we're less loaded here. You can get into a warrior 2. And remember, if you're just coming back, a warrior 2 can be just slightly bent in the knee. It doesn't have to be that low. But because I have a ball, I'm just going to show it with a ball. And you can also have a bigger ball, which will take you up higher, and you can still explore that less of a flexion in the front knee just on your higher ball. But just for the sake of this video, my ball's a little bit lower, but I'm still not really fully loading this warrior two pose with my full weight because I have this support underneath me. All right, and again, alignment is key. Building that proprioception where we start to connect to where our body is in space and what muscles we're applying more strengthening for. What muscles are being stretched. And then we'll work this into Trikonasana, slowly straightening, extending into that knee joint, reaching out through the whole right side, lifting up and off your hip joint, lowering down. And you can really work the leg back into the ball. It feels great. So it's almost applying that co-contraction for us. And then coming out of it, lowering down, sitting down. Take a breath. Remember, we use the arms, use the extension through the arms, getting nice and wide across the chest. We don't overuse the shoulders. Shoulders are soft and quiet in this pose, even though the arms are expressive and sharp. Go back to the Trikonasana. Really press against that ball. And back down. Remember, you can use the wall. There's a lot of ways that you can lessen the load in these poses. And just sit down. Find your warrior. Shoulders relaxed, eyes relaxed. Good. And then we're going to turn to face forward in a lunge pose. Good. Lunges are great because you can add a little bounce. Bringing the weight forward to the front heel, back, distributing your weight a little bit more. Good, using the arms however serves you. Good, and I like to lean forward, making a diagonal, coming into Dekasana, and that pours a lot of weight into the forward leg. To bypass the knee joint here, you really want to press into the right heel and build the awareness into your right outer hip and glute that supports and stabilizes this pose. It almost feels like you bypass the knee joint entirely. It's doing much less of the work. So again, creating that really precise attention. Going back to your warrior pose, straightening the legs, and you can do the other side. I'll show the other side without the ball. So again, like I said, coming out or just starting to explore, working back into your body after an injury, you can keep the warrior two really, really light. The tiniest bend in the knee, just feeling where it is, but just always making sure that alignment is correct. Knee over the midfoot, not drifting in, not drifting out. Good. And then when you get a little bit more comfortable, widening the feet apart more, playing a little bit more load. Again, using the ball or using a wall that you can prop your hand against, or using a chair underneath you. Good. Straightening and extending the joint when you need to. Back off, coming back down into it. Nice and slow. Working into Trikonasana. Hips to the and legs to the back. Upper body to the front. This pose especially is a little hard on the meniscus, right? It's a little hard on those meniscus tears because what happens is that this load really deforms the cartilage in the knee joint. So just being careful and then slowly going down, widening the heart, softening the shoulders. Remember not to jam down into your hand or if you're on a block, but that you want to be light here. So you want to really recruit the abdominals in this pose as well. And that lessens the load in the joints of the lower body as well. They have less to do. And then we're going to turn into that lunge. And again, any arms are just bouncing, making sure of that alignment of the front leg. Really squeezing in the glute muscle on the side of that left hip. Working the connection of the outer hip to the heel, bypassing that knee joint. And then maybe working in a diagonal forward. Bring a little bit more load over that front knee. Good, really squeeze. Try to bring a sense of that co-contraction here as well. Good. Pressing down, pushing down into that heel, connecting to that outer hip. Good. Knee doesn't have to do so much. Good. And open out. And straighten up. Beautiful. Heel toe the feet in. Yeah, one-legged balance poses are great too, like Warrior 3, going from high lunge to Warrior 3. You can work into, again, making sure you have enough support. So blocks or a wall, and then just lowering and lifting. Again, connecting the heel to the hip, less load on the knee joint. Hands could be at a wall or again on a chair. So find whatever support that makes sense for you where you are. Nice and slow. Okay, and then we're going to go to the wall again. So you can grab your stuff with you. If you have that ball, we're going to work it now into a twist. We'll do a reclined twist, and we'll have the ball at that spot where our gallbladder 31. Remember when you stood straight, if you need to straighten up again, kind of find that point, the tip of your middle finger. Just kind of give it a good press there and keep your finger there as you sit down again. And you're going to put your ball here. Lay down. Bend the knees. And then just let the knees go to one side with that ball right at that point. And you can bring a little movement into the leg or make little circles. You can start to sit up a little bit and bring a little bit more weight. It can be a tough point to work with. All right, and then we'll switch sides. So again, if you have to stand up again quickly and find the point, bring your ball there and come down with the ball in place. Step the knees. You want to stay up for a little bit more weight. This is a really yang point, so it's tight. You just want to breathe in and out. Keep your breath regular and smooth as you work into the point. Again, this is really good for any lateral knee pain that you may have. Nice. Do one strengthening exercise from hands and knees. I'm going to curl the toes into the floor, and you're just going to pick your knees up just a few inches off the floor, not very high. This can always be done on your forearms too, if you are a little bit working on strengthening and you're not quite there yet. So this is a little bit easier on the wrists and the arms. But I'm going to go ahead and demo it with straight arms, lifting just a few inches. And again, this is closed chain, so pretty much all of the postures I've been showing are closed chain. But just lifting the other leg slightly up and just working into the bottom leg, the leg that's connected, the closed chain leg. And just again, looking down at the right knee, making sure that it's aligned over the center of your right foot, even though it's behind it. You don't want it to be to the side or drifting in towards the center. Good. Working always on the structure of the alignment. This is really strengthening. You can feel it squeezing in with all of those muscles, co-contraction. Whew. Lower down and just take a sit back, get your blocks if you need those. I'm even going to take it a little further to stretch out the quads, breathing in and out before we go to the other side. You can do any quad stretch there. That one's too deep. And then you'll go on the other side. So working the left toes into the floor, left heel, left ankle is even, pressing on both sides, lifting just the right leg a little bit up and back. So all the concentration goes into that left leg. Really squeeze in, work those muscles against each other, but in a way that's very supportive for the joint. Can maybe glide a little forward and back. Whew. Doesn't look like much, but you stay in it a little longer, you will start sweating. And then take it back into any stretch you'd like. You can come down onto your forearms if that feels okay. Again, you can be higher up on your blocks, whatever you need, or you just do whatever quad stretch that feels good. All right, and then we're going to come to the wall. And this is another really good one. You can do this with bridge too, which will just add more load because it'll be more one leg. But you can also just do it with two legs. So you don't go up close to the wall with your seat. So give yourself a little bit of leeway. You want to be back. I'll go on my forearms here. You can have any supports that you need. And what we're going to do is we're going to scrape down, hence the socks, scrape down the right heel and push away the left heel. the whole time you're concentrating, and then go in the other direction. Scrape up with the right heel, scrape down with the left heel. Keep the feet flexed. It's going to kind of ensure that the knee doesn't torque in any way. You can also do this seated on the floor and just kind of scrape the legs forward. I like to do it on the wall. And also this is a little less load, of course. Scraping up, scraping down, create that tension. You can do it 2 heels at a time down and push them away. I really like doing it alternately. It just feels more natural. And then you can also do this with bridge. You might have to move in slightly. So lifting the hips is going to add a little bit more weight. Scraping one leg at a time, up and down. Bridge is great because it strengthens the hamstrings, opens up the quads, and then lowering, we get that eccentric contraction in the quads as we lower down. As you see from here, scoop the belly, lower down. So you can see the resistance against gravity, the quad muscles lengthening as we lower. Good. Squeezing up. Using the glutes, using the hips, using the hamstrings. And lowering down. Resisting gravity. Let down. Again. Okay, so let's do figure 4. So we have to watch this position with the knee joint always, a slight rotation in the knee joint. When we do figure 4 pose or pigeon pose, we always want to keep clutched in the foot, which resists against the torsion in the knee joint. Other side. Keeping that foot nice and flexed, protect the knee. And feeling where there might be any restriction in the hips that we try and compensate with the knees. Like poses like Baddha Konasana or half lotus, full lotus. Poses like that where, if we're too tight in the hips and we still kind of, bullishly try and enter into those poses, the force is going to go into the knee joint and skip the hips because there's just too much restriction. So that's, again, a big place where we can get meniscus tears and cracks. So always being clear about where the flexibility is coming from and work where you need to work. Stretch your hips more. All right. So coming up, let me see. To get this thing back in my ear. We can do Vipakarani at the wall to support the hamstrings and stretch. So you can take any stretch here, but I like this one. I like to set myself up to go up to the wall. I know a lot of people have difficulty, and getting their legs up and getting their hips really close to the wall. So sit alongside the wall with your right hip point right into the wall, and then lean onto your left forearm and then right forearm and swing the legs up. And you should be really tight against the wall. But then, of course, if you have tightness in your hamstrings and you're not that open, you don't want to be this close to the wall in Viparita Karani. So, you can take yourself a little bit further back and be in any position. I'm going to put a pillow back, just lie down, and this is just a nice pose to quiet the hamstrings down. Breathing in and out. There's another acupressure point I like to do. It's called Hedin. And it's just really for all around knee health. And if you flex your knees a little bit, you'll feel a little divot right at the very top, the top edge of the superior edge of your patella. And it's right in the center. And just kind of feel that divot, and then straighten the legs again and keep the pressure there. I love the way that feels. You can feel the energy really waking up into the lower legs, even down into the feet when I press this point. Again, smooth breathing in and out. And you can take any resting pose here that supports you, that feels comfortable. We worked a lot in the legs today. And I know that some people really like to feel like they got a full body experience. So you might want to take a few more stretches for the hamstrings and the quads, maybe the quads especially. So just care for your practice in the way that supports you the best. I want to talk a little bit before we end with the what I use Ayurvedically wise for the knee joints. And these are two products. I'll just show you. This is Myexel oil. It's really, really good to work into your Abhyanga practice, your oiling practice for your joints and your muscles. And this is what I get from Banyan. It's castor oil. Castor oil is a really good oil, a cooling oil. So if there's pain, you want a more cooling oil like castor oil or Mahanarayan oil. And Mahamasha oil is also an oil that I use a lot of. And that's great oil for strengthening. So, and also taking really nice warm soaks with Epsom salts, oiling up first so that the oil has a chance to really promote the strengthening through all of the herbal byproducts that are in there. So again, you want to bring the oil in if there's swelling. You don't want to oil. Wait till the swelling comes down, and then you can bring oil into your practice. So you want to keep that up. And as always, we'll close the eyes now. You can be at the wall still or in any comfortable pose that you like. And I'll end with just a simple guided meditation, something that we can reflect upon, especially when we have pain in the body and we associate that pain with so many narratives. So that habit is often very entrenched in the way we are and in these samskars that we have created for ourselves. So try to approach this with a very clean slate, looking at your pain in a completely different way, or your struggle or your healing journey. Take a few moments and just breathe into the entire surface area of your body. Breathe into the pores of your skin, sensing that the whole body is contained within. Then with the next breath, sense into the space immediately surrounding your body. Breathing out into that space, outside of the boundary of your skin, and sensing even into the space further beyond. Starting to imagine yourself not really bounded any longer or limited any longer by this body, by the boundary of this body, this material existence. Letting everything, every part of you float in that awareness that has no defined shapes, boundaries, or edges. Yielding and handing over the need to do, to act, to solve, and simply to surrender. Being held with something larger, vaster than the sky, vaster than the heavens, than the universe. Imagining when you get quiet enough, begin to notice the calm, the peace that lovingly invites you to receive it. Moving slowly towards that peace, connecting all the areas of your body to that peace, all the fragmentation, the pain, discomfort, the disappointments. Simply resting in and as that peace. I want to thank you so much for joining me for this segment on the knees. I hope it's very helpful. There's so much on the internet, and there's really great ways to kind of find traction in the knee joint, which I also use for my own healing. And you can just go and find a demonstration of that if that's something that's really bothering you. It helped me a lot. I just didn't have the time to include this in the video, but there's plenty of it out there if you want to check that out and just look up knee traction and ways that you can do that for yourself. And other than that, I'm really happy to be here and on your side and working with your healing journey. Thank you so much. And conscious well-being. Let's be conscious about everything.